Diseases often seem to appear out of nowhere, leaving individuals confused and concerned about their health. In today's discussion, we will explore 10 diseases that are not just medical conditions, but vital signals from your body trying to communicate with you. Understanding these signals is essential because they can reveal underlying issues that, when addressed, can lead to a healthier and more vibrant life. Stay with us until the end to gain actionable insights that will empower you to take control of your health, make informed decisions, and transform your well-being. Before we begin, I would appreciate it if you liked this video. Your support helps me continue to spread valuable health lessons. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any upcoming videos. Also, please comment number 1 if you like this video or 0 if you don't, so I can improve the content for you. Now let's get started. Obesity is a complex health condition marked by excessive accumulation of body fat, typically defined by a body mass index, BMI, of 30 or higher. It often results from a combination of genetic, environmental, and behavioral factors, frequently reflecting unhealthy lifestyle choices. A diet rich in processed foods, sugars, and unhealthy fats, coupled with a sedentary lifestyle, is a significant contributor to obesity. The impact of obesity on health cannot be overstated, as it is associated with several serious health complications that affect both the quality and longevity of life. Individuals with obesity are at a significantly higher risk of developing chronic conditions like type 2 diabetes, which impairs the body's ability to regulate blood sugar levels. This condition can lead to severe complications, including nerve damage, kidney failure, and cardiovascular disease. Moreover, obesity is a primary risk factor for cardiovascular diseases like heart disease and stroke, conditions caused by high blood pressure, elevated cholesterol, and alongside screenings, adopting lifestyle modifications is key to enhancing cardiovascular health. One of the most impactful changes an individual can make is quitting smoking. Studies have shown that smoking cessation significantly lowers the risk of cardiovascular disease and improves heart health. For those struggling to quit, support groups, counseling, and pharmacological aids can provide assistance and encouragement. In addition to quitting smoking, increasing physical activity is vital. Regular aerobic exercises, such as walking, jogging, swimming, or cycling, can strengthen the heart, improve circulation, and lower blood pressure. It is recommended that adults aim for at least 150 minutes of moderate-intensity aerobic exercise each week, in addition to muscle-strengthening activities on at least 2 days a week. Even small lifestyle changes, such as opting for stairs instead of the elevator or incorporating more walking into daily routines, can lead to significant health improvements over time. A balanced diet plays an essential role in managing cardiovascular health. Emphasizing whole grains, fruits, vegetables, lean proteins, and healthy fats can help maintain healthy cholesterol levels and support overall heart function. Reducing the intake of processed foods, saturated fats, and added sugars is equally important. By committing to regular screenings and making conscious lifestyle choices, individuals can take proactive measures to enhance their heart health and reduce the risk of cardiovascular disease. Autoimmune disorders, such as lupus and rheumatoid arthritis, represent a group of diseases where the body's immune system mistakenly attacks its own healthy cells and tissues. This misdirected immune response can lead to a variety of symptoms ranging from mild to severe, significantly impacting daily life. The presence of these conditions often indicates chronic inflammation, which can affect various organs and systems in the body. Research suggests that autoimmune disorders arise from a combination of genetic predispositions and environmental factors. While certain individuals may be genetically more susceptible to these conditions, environmental triggers like viral infections, exposure to toxins, hormonal changes, and even lifestyle factors such as diet and physical activity can exacerbate symptoms. Understanding the complex interaction between genetics and environmental factors is crucial for managing these conditions effectively. Managing autoimmune diseases requires a holistic approach that includes a balanced anti-inflammatory diet, stress management, and regular physical activity tailored to individual needs. Eating foods rich in anti-inflammatory properties such as fruits, vegetables, omega-3 fatty acids from fatty fish, flax seeds, and walnuts, and healthy fats like olive oil and avocado can help control inflammation. It is also important to avoid processed foods, refined sugars, and trans fats, which can contribute to inflammation and other health issues. In addition to dietary adjustments, managing stress is essential. Chronic stress can trigger flare-ups and worsen symptoms of autoimmune disorders. Practices such as mindfulness meditation, yoga, deep breathing exercises, and engaging in enjoyable hobbies can significantly reduce stress and improve both mental and emotional well-being. Regular physical activity, adapted to individual capabilities, can also enhance mood, lower stress, and improve overall health. Regular checkups with healthcare professionals specializing in autoimmune disorders are essential for monitoring health, adjusting treatment plans, and addressing any new symptoms. Support groups, either online or in person, can provide valuable emotional support and a sense of community, offering shared experiences and encouragement. By adopting a comprehensive approach that combines diet, stress management, and physical activity, individuals with autoimmune disorders can significantly improve their quality of life. In conclusion, many diseases are not just isolated health issues. They are often signs from the body that, when understood and addressed, can lead to better health and well-being. By making informed decisions about lifestyle changes, such as adopting a healthy diet, increasing physical activity, reducing stress, and seeking regular medical screenings, we can significantly improve our health outcomes and prevent or manage chronic conditions effectively. Taking these steps not only benefits individuals, but also contributes to a healthier and more vibrant community. Have you ever noticed how certain diseases seem to appear out of nowhere, leaving you feeling confused and concerned? In today's video, we're going to explore 10 diseases that are not just medical conditions, but vital signs your body is trying to communicate with you. Understanding these signs is crucial because they can reveal underlying issues that, when addressed, can lead to a healthier and more vibrant life. Stay with us until the end to discover actionable insights that will empower you to take control of your health, make informed decisions, and transform your well-being. Before we dive in, I would appreciate it if you could like this video. By doing so, you help me continue spreading these valuable lessons. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any of our videos. If you like this video, please comment 1. If you don't like it, comment 0 to let me know so I can make a better video for you. Now, let's get started. Obesity is a multifaceted health condition that's become increasingly prevalent worldwide. It's characterized by an excessive accumulation of body fat, typically defined by a body mass index, BMI, of 30 or higher. Obesity often results from a complex interplay of genetic, environmental, and behavioral factors. It's frequently a reflection of unhealthy lifestyle choices, such as diets high in processed foods, sugars, and unhealthy fats, along with a sedentary lifestyle. Obesity is linked to an array of serious health complications, including type 2 diabetes, cardiovascular diseases, and certain types of cancer. Additionally, obesity can have a profound impact on mental and emotional well-being. Many people with obesity face stigma, leading to feelings of isolation, low self-esteem, and mental health issues like depression and anxiety. Combating obesity requires a comprehensive and sustainable lifestyle change, starting with a balanced diet that emphasizes whole, nutrient-dense foods. A well-rounded diet should include plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. In addition to dietary changes, Incorporating regular physical activity into daily routines is crucial for maintaining a healthy weight. Engaging in at least 150 minutes of moderate-intensity aerobic exercise each week, such as brisk walking or swimming, can significantly contribute to weight loss. Strength training exercises, performed at least 2 days a week, can also help build lean muscle mass, boosting metabolism and supporting weight management. Cardiovascular disease, CVD, remains one of the leading causes of death globally. It is often a sign of underlying risk factors, such as high cholesterol, smoking, a sedentary lifestyle, and high blood pressure, all of which contribute to poor heart health. These risk factors can lead to the narrowing of arteries, reducing blood flow, and increasing the risk of heart attacks and strokes. Understanding these risks early is essential to preventing cardiovascular disease. Regular health screenings are vital, as they allow healthcare professionals to identify potential problems and implement interventions. Lifestyle modifications, such as quitting smoking, increasing physical activity, and adopting a heart-healthy diet, can significantly reduce the risk of developing cardiovascular diseases. Quitting smoking is one of the most impactful changes an individual can make for heart health. In addition to quitting smoking, engaging in regular aerobic exercises like walking, cycling, or swimming can strengthen the heart, improve circulation, and lower blood pressure. A balanced diet that emphasizes whole grains, fruits, vegetables, lean proteins, and healthy fats can also help maintain healthy cholesterol levels and support overall heart health. By making these lifestyle changes and scheduling regular screenings, individuals can significantly reduce their risk of cardiovascular diseases and improve their overall well-being. Autoimmune disorders, such as lupus and rheumatoid arthritis, represent a group of complex diseases in which the body's immune system erroneously attacks its own healthy cells and tissues. This misdirected immune response leads to chronic inflammation, which can impact various organs and systems throughout the body. Autoimmune diseases can arise due to a combination of genetic factors and environmental triggers, such as viral infections, toxins, hormonal changes, and even stress. Managing autoimmune disorders effectively requires a proactive approach that includes dietary changes, stress management, and regular physical activity. A balanced diet that is rich in anti-inflammatory foods can help manage autoimmune conditions, including fruits, vegetables, omega-3 fatty acids from sources like fatty fish, flax seeds, and walnuts, as well as healthy fats like olive oil and avocado, can reduce inflammation. Reducing or eliminating processed foods, refined sugars, and trans fats can also help combat inflammation. Managing stress is equally important in the management of autoimmune diseases, as chronic stress can exacerbate symptoms. Incorporating stress-reducing practices such as mindfulness, meditation, yoga, and deep breathing exercises can have a significant positive impact on mental and physical health. Furthermore, engaging in regular physical activity tailored to your capabilities can improve overall health and reduce stress levels. Staying informed and seeking professional medical advice are crucial to managing autoimmune disorders effectively. Memory decline is a natural part of aging that many individuals experience. It can be disconcerting to forget where you placed something or struggle to recall information. However, these lapses don't necessarily indicate the onset of dementia or a serious cognitive decline. As we age, the number of neurons in the brain gradually decreases, leading to subtle changes in memory and cognitive function. Engaging in regular physical exercise to combat the effects of aging on vision, adopting good lifestyle habits is crucial. A well-balanced diet rich in various vitamins and antioxidants plays a fundamental role in promoting eye health. Nutrients such as vitamin C, vitamin E, lutein, and omega-3 fatty acids have been shown to support optimal eye function and may help reduce the risk of developing age-related vision problems. Additionally, engaging in regular physical activity is equally important as it enhances blood circulation and positively affects overall eye health. Beyond dietary and lifestyle considerations, it is vital to prioritize routine eye examinations. These regular checkups serve as a proactive measure, enabling healthcare professionals to monitor vision changes and detect potential issues at an early stage. Comprehensive eye exams can help identify conditions such as glaucoma, diabetic retinopathy, and macular degeneration, which may remain asymptomatic until they reach advanced stages. Early detection is essential for managing these conditions effectively in preserving vision. However, it is essential to emphasize that vision problems in the elderly are not solely a consequence of the natural aging process. While conditions like cataracts are commonly associated with aging, they can also be precipitated by a range of other factors. For instance, genetics can play a significant role. Individuals with a family history of eye diseases may be at a higher risk of developing similar conditions. Furthermore, previous eye injuries can leave lasting effects that contribute to vision impairment later in life. Certain health conditions, such as diabetes and hypertension, are also linked to an increased risk of eye-related issues, highlighting the importance of managing overall health to mitigate these risks. Environmental factors, such as prolonged exposure to ultraviolet, UV light without adequate protection, or the cumulative effects of blue light emitted from screens, can further exacerbate age-related vision problems. This reality underscores the importance of implementing protective measures, such as wearing sunglasses outdoors to shield against harmful UV rays and using blue light filters on electronic devices to minimize potential damage. By taking these steps, individuals can contribute to their eye health and maintain clear vision as they navigate the aging process. Osteoporosis is a serious medical condition characterized by the progressive weakening of bones, leading to increased brittleness and a higher susceptibility to fractures. The term osteoporosis literally means porous bones, reflecting the structural changes that occur within the bone matrix as it loses density and strength over time. This condition often develops silently, with individuals unaware of their declining bone health until a fracture occurs. The gradual depletion of calcium and other essential nutrients plays a primary role in the onset of osteoporosis. As we age, our bodies become less efficient at absorbing these critical nutrients, resulting in a decrease in bone density that can leave bones fragile and vulnerable to injury. Bone loss typically progresses without noticeable symptoms, making it particularly insidious. Many people may not realize they are suffering from osteoporosis until they experience a fracture. These fractures can happen from seemingly minor falls or even through normal daily activities, such as bending over or lifting objects. Common sites for osteoporotic fractures include the hip, spine, and wrist. For instance, a hip fracture can significantly impair mobility and independence, often necessitating extensive medical intervention and rehabilitation. Furthermore, spinal fractures can lead to chronic pain, deformities, and a reduced quality of life, underscoring the importance of proactively addressing bone health. Several risk factors contribute to the development of osteoporosis. Age is a significant factor, as bone density tends to decrease after reaching peak bone mass in early adulthood. Gender also plays a crucial role. Women, particularly postmenopausal women, are at a higher risk due to the drop in estrogen levels, which is vital for maintaining bone density. Additional contributing factors include family history, body frame size, low physical activity levels, smoking, excessive alcohol consumption, and inadequate nutrition, particularly a lack of calcium and vitamin D. Preventing osteoporosis requires a multifaceted approach centered around nutrition and lifestyle choices. A well-balanced diet is essential for maintaining bone health. and calcium is a crucial mineral that forms the foundation of bone structure. Adults generally require about 1,000 to 1,200 milligallons of calcium daily, depending on age and gender. To enhance calcium intake, it is important to incorporate calcium-rich foods into the diet, such as dairy products, milk, cheese, yogurt, leafy green vegetables, kale, broccoli, collard greens, and fortified foods, orange juice, cereals. In addition to calcium, vitamin D is vital for optimal bone health, as it helps the body absorb calcium effectively. This essential vitamin can be obtained from sunlight exposure, fatty fish, fortified dairy products, and supplements if necessary. Maintaining adequate vitamin D levels is particularly important, especially in populations with limited sun exposure or dietary intake. Alongside a balanced diet, regular physical activity is critical in preventing osteoporosis. Engaging in weight-bearing exercises such as walking, jogging, dancing, and resistance training stimulates bone formation and can lead to increased bone density. These activities place stress on the bones, encouraging them to adapt and strengthen. It is generally recommended to aim for at least 150 minutes of moderate intensity exercise each week, complemented by muscle strengthening activities on 2 or more days. In addition to nutrition and exercise, regular checkups with healthcare professionals are essential for monitoring bone health, particularly for individuals at higher risk of osteoporosis. Healthcare providers may recommend bone density tests, such as dual energy X-ray absorptiometry, DEXA, to determine bone mineral density and identify early signs of osteoporosis. This early detection allows for timely intervention, which can include lifestyle modifications, dietary adjustments, a tailored exercise program, and in some cases, medication to help strengthen bones. In summary, osteoporosis is a significant health concern that requires proactive measures to prevent and manage. By prioritizing a nutrient-rich diet, engaging in regular physical activity, and staying vigilant about bone health through medical checkups, individuals can take essential steps toward maintaining strong and healthy bones throughout their lives. Nodules are abnormal lumps or masses that can develop within various biological tissues throughout the body. These growths can manifest in many forms and locations, potentially affecting a wide range of organs. Nodules are abnormal lumps or masses that can develop within various biological tissues throughout the body. These growths can manifest in many forms and locations, potentially affecting a wide range of organs. Common sites for nodules include the lungs, thyroid gland, liver, kidneys, and even the skin. Due to their varying characteristics and locations, nodules can present unique diagnostic challenges and require careful evaluation. The formation of nodules may arise from a diverse array of factors, including inflammation, infection, hormonal changes, or even benign growth processes. It is important to highlight that not all nodules are indicative of serious health concerns. Many nodules are harmless and result from non-threatening conditions that do not necessitate extensive medical intervention. Understanding the underlying causes of nodules is essential for providing appropriate care and managing patient anxiety. The causes of nodules can be quite diverse and context-dependent. For example, nodules in the thyroid gland may occur due to hormonal imbalances or the presence of benign cysts, which are fluid-filled sacs. On the other hand, lung nodules might arise from infections such as pneumonia or tuberculosis, as well as granulomas, inflammatory tissue, or benign tumors. Chronic inflammatory conditions like rheumatoid arthritis or sarcoidosis can also lead to the formation of nodules in various tissues. Understanding the specific etiology of a nodule is critical for determining its potential impact on health and guiding treatment options. When a nodule is identified, often through a physical examination, imaging study, or even incidentally during diagnostic scans for unrelated issues, healthcare professionals typically follow a systematic approach to evaluate its nature. The first step in this evaluation usually involves a thorough medical history and physical examination. This initial assessment is crucial for gathering information regarding any symptoms the patient may be experiencing, which can provide valuable insights into whether the nodule is associated with notable changes in health, such as unexplained weight loss, persistent cough, or localized pain. Following this initial assessment, a series of diagnostic tests and evaluations are typically conducted to better understand the nodule's characteristics. Imaging techniques such as ultrasound, computed tomography, CT scans, or magnetic resonance imaging, MRI, are commonly employed to provide detailed information about the size, shape, and location of the nodule. These imaging studies help visualize the nodule's characteristics and its relationship with surrounding tissues, which is critical for making informed decisions regarding further management. For instance, the presence of calcifications within a nodule may suggest a benign process, while irregular borders or rapid growth might raise concerns about malignancy. In certain situations, a healthcare provider may recommend a biopsy to obtain a tissue sample from the nodule. This procedure involves extracting cells from the nodule, which can then be analyzed in a laboratory setting to determine their cellular composition. Biopsies play a crucial role in differentiating between benign and malignant nodules, providing definitive information that guides treatment decisions and alleviates patient concerns. It is essential for patients and their families to understand the context of nodules in the medical landscape. The discovery of a nodule can understandably provoke anxiety, as it raises questions about its nature and potential health implications. However, it is vital to remember that the vast majority of nodules are benign and may not necessitate aggressive treatment. Many nodules can be monitored over time through regular follow-up appointments and imaging studies, allowing healthcare providers to assess any changes in their size or characteristics. Through thorough investigation and thoughtful monitoring, healthcare providers can guide patients toward appropriate management options. This may include a watchful waiting approach for benign nodules, medical treatment for underlying conditions, or surgical intervention if there is concern regarding malignancy. Overall, the key to navigating the discovery of a nodule lies in effective communication with healthcare professionals who can provide clarity and reassurance based on a comprehensive understanding of the nodule's significance and the individual's overall health status. By fostering an environment of open dialogue and support, patients can feel empowered to take an active role in their healthcare journey, leading to better outcomes and reduced anxiety surrounding their condition. If you are still watching this video and finding these lessons useful, please comment number 4 below to let me know that you are still watching this video with me. Thank you for your valuable time. Insomnia is another common issue that arises with aging. In our younger years, the process of falling asleep often felt like a seamless and effortless transition from wakefulness to slumber. We would close our eyes at night, and it seemed as if we were magically transported into a deep, restful sleep, awakening the next morning refreshed and rejuvenated. The world felt inviting, and sleep was a natural and uncomplicated part of our daily rhythm. However, as we age, many individuals begin to experience significant changes in their sleep patterns. What was once an instinctive process can evolve into a nightly struggle, leaving many tossing and turning in bed, desperately seeking the peaceful rest they long for. The phenomenon of insomnia can stem from a multitude of factors, and understanding these influences is key to addressing this common issue. One significant contributor to insomnia is the gradual desynchronization of our biological clock, specifically our circadian rhythms, which regulate our sleep-wake cycles. As we grow older, these rhythms can become misaligned with our daily routines and commitments, leading to difficulties in achieving restorative sleep. Lifestyle changes that often accompany aging, such as retirement, reduced physical activity, or altered social interactions, can further exacerbate this misalignment, making it increasingly challenging to establish and maintain a consistent sleep pattern. In addition to biological changes, the pressures and challenges of life can weigh heavily on our minds, particularly during stressful periods. The cumulative effects of responsibilities, worries, and daily demands can lead to heightened anxiety and mental unrest, making it difficult to unwind and relax at night. As our bodies undergo various physical changes associated with aging, such as hormonal fluctuations, alterations in metabolism, and increased discomfort from chronic conditions, we may find ourselves experiencing restlessness or needing to make more frequent trips to the bathroom, further complicating our ability to achieve restful sleep. Regardless of the numerous reasons contributing to insomnia, it is essential to approach this condition with a calm and accepting mindset, recognizing that difficulties with sleep are a common experience, particularly as we age. Acknowledging this can help alleviate some of the anxiety and frustration that often accompany sleepless nights. It's vital to remember that insomnia is not an insurmountable challenge, but rather a condition that can be managed effectively with patience and proactive strategies. To combat insomnia and enhance sleep quality, it is crucial to explore and implement various approaches tailored to individual needs. Establishing a consistent sleep schedule is fundamental to this effort. This means going to bed and waking up at the same time each day, even on weekends, to reinforce our body's internal clock. Such consistency can make it easier to fall asleep and wake up naturally, promoting healthier sleep patterns over time. Creating a calming bedtime routine can significantly enhance our sleep experience as well. Engaging in relaxing activities such as reading, meditation, or gentle stretching can help prepare the body and mind for sleep, making it easier to transition into a restful slumber. Nodules are abnormal growths or lumps that can form in various parts of the body. They commonly appear in the lungs, thyroid, liver, kidneys, and even the skin. Because of their varying characteristics and locations, nodules can pose unique diagnostic challenges requiring careful evaluation. The formation of nodules can arise from many factors such as inflammation, infection, hormonal changes, or benign growth processes. It's important to remember that not all nodules are harmful. Many are harmless and result from non-threatening conditions that don't require extensive medical treatment. Understanding the underlying causes of nodules is crucial for providing appropriate care and managing patient anxiety. For example, nodules in the thyroid gland may occur due to hormonal imbalances or benign cysts, while lung nodules might arise from infections like pneumonia, tuberculosis, or granulomas. Chronic inflammatory conditions such as rheumatoid arthritis or sarcoidosis can also lead to the formation of nodules in different tissues. The causes can vary significantly, so understanding the specific cause is key for treatment. When a nodule is found, whether through a physical exam, imaging study, or incidentally during unrelated scans, healthcare professionals take a systematic approach to evaluate it. A thorough medical history and physical exam are typically the first steps. This helps gather information on any symptoms the patient is experiencing, which can provide insights into whether the nodule is associated with unexplained weight loss, a persistent cough, or localized pain. Following this, diagnostic tests like ultrasound, Connecticut scans, or MRI are used to understand the nodule's size, shape, and location. These imaging techniques reveal the nodule's characteristics and its relationship with surrounding tissues, which are essential for making informed decisions about further management. For instance, calcifications within a nodule may suggest a benign process, while irregular borders or rapid growth might raise concerns about malignancy. In some cases, a biopsy may be recommended to obtain a tissue sample. This helps differentiate between benign and malignant nodules and provides more clarity for treatment options. While the discovery of a nodule can be alarming, it's important to remember that most are benign and may not require aggressive treatment. Many can be monitored over time with regular follow-up appointments and imaging studies. In most cases, healthcare providers can guide patients toward the appropriate management. This could include a watchful waiting approach for benign nodules, medical treatment for underlying conditions, or surgery if there's concern about malignancy. Effective communication with healthcare professionals is essential, as it helps patients understand the significance of the nodule in the context of their overall health. alleviating some of the anxiety and uncertainty. As we grow older, falling asleep becomes a nightly challenge for many people. In youth, sleep comes easily, but as we age, sleep patterns often change, making it difficult to achieve restful sleep. Insomnia, which is common in older adults, can be caused by many factors, including the misalignment of circadian rhythms, lifestyle changes like retirement, reduced physical activity, or the challenges that come with aging, such as hormonal fluctuations or chronic discomfort. Anxiety and mental unrest from daily stresses can also make it harder to relax at night. Despite these challenges, insomnia can be managed with patience and proactive strategies. Establishing a consistent sleep schedule is one of the most effective ways to improve sleep quality. Going to bed and waking up at the same time each day reinforces the body's internal clock. Creating a calming bedtime routine, such as reading, practicing gentle yoga, or taking a warm bath, can also signal to the body that it's time to wind down. Ensuring the sleep environment is conducive to rest, keeping the room dark, quiet, and cool, can significantly improve sleep quality. Regular physical activity, though not too close to bedtime, can also promote better sleep. Avoiding caffeine and heavy meals in the evening is equally important, as these can disrupt sleep. Mindfulness and relaxation techniques such as meditation or deep breathing can also help manage insomnia. These practices calm both the mind and body, making it easier to transition into sleep. If these strategies don't help and insomnia persists, it might be time to seek guidance from a healthcare professional. A sleep specialist can help identify underlying issues and recommend tailored treatments to restore healthy sleep patterns. Arterial plaque formation, or atherosclerosis, is a common process that occurs as we age. Plaques made up of fatty deposits, cholesterol, and calcium gradually build up within the arteries, leading to hardening and narrowing. This condition significantly impacts blood flow, increasing the risk of heart attacks, strokes, and peripheral artery disease.